Bismillah ar-Rahman ar-Rahim. In this lecture we will describe the craniovertebral junction anatomy. This junction is present between the occiput or the skull and the upper two cervical vertebrae, which are the atlas and the axis. This junction is very important because why? It contains vital neurovascular structure, which are the spinal cord and the vertebral artery, as well as it is the most movable part of the vertebral column. This junction is formed from joints and ligaments. The joints are the atlanto-occipital joint and the atlanto-axial joints. The atlanto-occipital joint is a synovial joint between the inferior surface of the occipital condyle and the superior articular facet of the atlas. It is a synovial joint, of course bilateral, right and left, between the inferior articular surface of the occipital condyle and the superior articular facet of the atlas. This joint permits deflection, forward deflection 15 degrees, backward, this is extension 16 degrees, and lateral flexion either to the right or to the left. This is the atlanto-occipital joint, which is the first junction between the skull and the vertebral column. The second is the atlanto-axial joints. Atlanto-axial joints complex are median atlanto-axial joint, median between the dens of the axis and the anterior arch of the atlas. The dens of the axis articulates with a facet on the posterior surface or on the back of the anterior arch of the atlas. This is the atlas. This is the anterior arch. This is the dens. It articulates with the back of the anterior arch of the atlas as the median atlanto-axial joint. A synovial joint of pivot variety. This is the lateral atlanto-axial joint between the superior articular facet of the axis and the inferior articular facet of the atlas on both sides. Hence the atlanto-axial joint are three joints, one in the median plane, which is the median atlanto-axial joint, and the two lateral joints, which are the lateral atlanto-axial joint between the superior articular facet of axis and the inferior articular facet of atlas. The median atlanto-axial joint is a synovial joint of pivot variety between the dens of axis, its anterior surface carries articular facet, which articulate with a facet on the back of the anterior arch of the atlas. The lateral atlanto-axial joint are synovial joints of plane variety. The movement permitted here is rotation, either to the right or to the left, to say as you say no, the head rotates to the right or to the left. These are the craniovertebral joints, atlanto-axial joint and atlanto-occipital joint. What are the ligaments which connect the cranium or the skull with the upper cervical vertebrae? These ligaments are first, the cruciate ligament. It is cruciate, cross-shaped, consists of upper longitudinal and lower longitudinal and the transverse band. This transverse band lies behind the back of the dens. Even it has a facet. It has a facet on the back of the dens. This facet marks the site of the transverse band of the cruciate ligament. This is a very strong ligament. It is a very important ligament in our body. If it is cut, the dens may displace or is displaced backwards and injure the spinal cord. This may lead to death. This is the transverse band of cruciate ligament. This is the upper longitudinal band. This is the lower longitudinal band of cruciate ligament. This is the apical ligament. If you look to the dens of the axis like this, two ligaments stretch from its side to the base of the skull. They are called alar ligament. And one median ligament is called apical ligament. Apical ligament connects the apex of the dens with the base of the skull, and while the alar ligament connects the sides of the dens with the base of the skull. The apical ligament has nothing to do with the stability of craniovertebral connection. It may be absent in 20% of individuals. Returning back, this is the cruciate ligament. This is the cruciate ligament, and this is the transverse ligament, which is the transverse band of cruciate ligament. A very important ligament. This is the apical ligament, which connects the apex of the dens with the base of the skull. This is the alar ligament, which connects the sides of the dens with the base of the skull. This is the tectorial membrane, that is the continuation of the posterior longitudinal ligament, which lies in the vertebral canal behind the vertebral bodies. This is the another ligament called nuchal ligament. It connects, it is stretched from the external occipital protuberance to to the spine of the seventh cervical vertebra. This ligament prevents hyperflexion of the cervical spine. It prevents hyperflexion of the cervical spine. Hence, these are the craniovertebral connections. Craniovertebral, the connection between the skull or the cranium with the backbone, which is the vertebral column. The craniovertebral connection is formed from, as we said, from joints, which are 5 joints, 2 atlanto-occipital joints and 3 atlanto-axial joints. These are very important joints. Why? Because they connect the cranium with the upper cervical vertebrae, and this area contains vital structures, which are the spinal cord and the vertebral artery. This is the atlanto-axial joint, median atlanto-axial joint, the median atlanto-axial joint, and the 2 lateral atlanto-axial joint. All are synovial joints. The atlanto-axial joint, the median atlanto-axial joint is of pivot variety, while that of the lateral atlanto-axial joint is of a plane variety. This is the vertebro-cranial connections. By this lecture, we complete the anatomy of the vertebral column. I hope that it will be beneficial to our dear students. Thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.